think that it's very clear that there are a huge number of different interest groups and people with expertise related to diabetes, and that right now Ontario has an unprecedented opportunity to intervene and make a change in the way that diabetes care is provided. I think the most important message is that the intervention has to take two perspectives. It has to first take the perspective of the patient with diabetes. How can the individual with diabetes get the best care at the primary care level, at the secondary, at the tertiary care level, number one. Number two, it has to take the perspective of the system. How can the system facilitate care for the patient at the primary care level, facilitate care for the patient at the secondary and tertiary level, and how can the system facilitate communication between the tertiary care level, between the experts, and the primary care level. And I think the important insight that came out is the importance of developing centers or areas or regions of excellence within each region, and knowledge and information from that center of excellence goes down and up to the primary care level and back up to the center of excellence. And that would allow local solutions to be found for local problems. I think a number of important things have to happen. First is there needs to be systems in place to leverage the skills that physicians and that allied health professionals have when they're working together. Physicians have their own unique set of skills. Nurses, dietitians, kinesiologists, social workers, psychologists have their own unique set of skills. When they are working apart from each other, they can only provide limited input into the care of people. When they're working together, the amount of work that they can do together magnifies each other because their skills magnify each other's abilities to quite a large degree. I think that's an important thing that needs to be done. Another important thing that needs to be done is we need to have good metrics in place so that any system change to how diabetes care is provided is measured, and that we can assess whether it's made a difference to patients and whether there's any differences between the way it's delivered or implemented in one region of the province compared to another region of the province. If we don't measure it, it never happens. If it never happened, then we can decide a totally different thing to do 5 years from now, which will have no bearing, and we will not have learned anything when we do something 5 years from now. We need to measure it in order to go forward.